Healthcare reform is going to take steps to try to fix some of the broken, backwards-ass things in our system. First, I'll go over what the healthcare reform legislation is proposing. Then I'll go over some of the myths in the media. The new healthcare reform legislation plans to improve accessibility, affordability, and quality of healthcare. Accessibility means if a patient doesn't have health insurance, it's a huge deterrent from going to the doctor or going to the hospital. Because if you have to pay out of pocket, it's hundreds and hundreds of dollars, and there's no possible way you can afford it. So people just don't go. Alright?
Healthcare reform legislation is going to attempt to give everybody health insurance, so they will regain that access. They'll be able to get medical care when they need it.
Affordability. Affordability means private insurance companies charge really high premiums if you have pre-existing conditions. This basically weeds out anyone who's actually sick and will actually cost money for the insurance company, prevents them from getting insurance. The healthcare reform legislation will prevent insurance companies from keeping people from getting insurance because of pre-existing conditions they have. So people who are sick and need health insurance can actually get it. Improving quality. Right now, doctors are paid for the amount of patients they see. Okay? If they see 24 patients and do a crappy job seeing them all, they'll get paid twice as much as if they see 12 patients and treat them very well. Doctors don't really get paid right now for counseling patients. They do get paid for ordering tests on patients and doing procedures on patients. The new legislation will change the incentive from reimbursing doctors for the amount of things they do, whether it's good quality or bad quality, to how well their patients are doing. If they're giving good quality care to their patients, if their patients are healthier, if their patients' blood pressure is lower, things like that. Another central part of the healthcare reform legislation is setting up a public option, which means that if you can't find a good private insurance plan, there's going to be a public one that you can sign up for. It's an option. It doesn't mean you have to sign up for it. It means it's an alternative. So for example, my sister, who only has a part-time job and can't get health insurance coverage, has this option set up by the government to cover her insurance. This will be an excellent opportunity for some of the 47 million people without health insurance to get health insurance coverage. Additionally, having a public option will help keep other insurance companies more honest. Because if the public plan is offering good health care for a reasonable price, which everyone should have access to, the private insurance companies are offering crappy health care for a very expensive price, more people will switch to the public option.
Another issue that healthcare reform legislation is gonna emphasize is primary care and prevention. This is what will make Americans healthier. This will make it so we're not the worst of all Western countries in life expectancy. If you see a doctor on a regular basis and screen for common diseases and get preventative screening tests, and you find the diseases earlier, and you treat them earlier, it'll make Americans overall healthier. As I've already stated, right now the case is backwards because people are deterred from going to their doctor or their hospital because they can't afford it. So they wait until the disease gets worse, until they get sicker. and then they die earlier. Click on this link to proceed to the specifics of HR 3200 healthcare reform legislation. Click on this link to proceed to myths of healthcare reform.